Like and subscribe now, or you're gonna have bad luck this week.
Surgeries are already very anxiety-striking, let alone someone having an experience of the anesthesia wearing off and waking up during the procedure. In this video, we'll share 10 such incidences in which people woke up during their surgeries. From torture during throat surgery to the woman who got PTSD after waking up halfway through her operation. We'll be covering all, so make sure to stay tuned in till the very end. Number 10. Donna Penner. In 2008, Donna Penner went to get abdominal surgery in a Canadian hospital. She was just 44 years old and experiencing unusually heavy bleeding during her periods, which made her suspicious, so she opted for surgery. The surgery she was to get was a laparoscopy, a very standard and safe procedure. However, she was having a little anxiety, and it turned out that she had it for a good reason. Even though the operation started smoothly, things took a very wrong turn pretty quickly. The anesthesiologist administered an IV drip, made her breathe through a mask, and she went into a peaceful sleep. But soon after, Donna woke up, and as she said, she was able to hear sounds inside the operating room. It was only the beginning of the surgery, and she'd already woke up. To top that, the first words she heard were, "Scalpel, please." They were starting to cut her open, but she couldn't do anything because even though the anesthetics hadn't worked, the paralytics had, which meant she couldn't move. She could feel all the pain she was going through when the doctors cut her abdomen open. She had to go through all this torture for 1.5 hours. After, she had to seek therapy because she was horribly traumatized due to the whole thing. Number 9. Fern Settle. Fern Settle had a ruptured appendix and went into surgery to treat it. Unfortunately, the general anesthesia didn't work quite the way it was expected to. According to the New York Post, Fern woke up to a stabbing pain in his abdomen and a feeling as though he were choking to death. Can you even imagine the horrific experience he might have had? The choking feeling was due to the tube that had been inserted through his throat, and the stabbing pain he felt was due to the incisions the surgeons had made in the lower half of his abdomen to excise his ruptured appendix. Fern tried to grab the attention of the doctors, but unfortunately, he was paralyzed just like Donna and was unable to do anything. He had to bear all that pain in silence. He described his experience as being locked in his own body and said that it was like his worst nightmare had come true. Can you even imagine how horrified he must have been? When the operation was over and Fern described his experience, the doctor said that it was just a dream, but later it was found out that it wasn't just a dream. The nurse had noted his weight 40 pounds or 18 kilograms less than his actual weight, and that's why the dose of anesthesia hadn't been enough to enable him to sleep peacefully throughout the surgery. Number 8. Sarah Thomas. Sarah Thomas experienced excruciating agony when she became conscious during an operation to take out her tonsils. She had absolutely no way to alert the surgeons of what was going on, and she was locked in horrifying pain like you couldn't even imagine. She said that she was in extreme pain but couldn't do anything at all, just scream inside her head as she couldn't possibly voice the pain at the moment due to the paralytics she had been given. It took 15 minutes for the nurses to realize that the anesthetic had worn off, and by that time, Sarah had already experienced a hell of a lot of pain. Since then, Sarah has experienced nightmares, flashbacks, and crippling panic attacks. She had to go through all of this only because of a faulty machine that did not alert the medical staff that the anesthesia was wearing off. This is a pure case of negligence by the hospital, doctors, and the paramedic staff who should have checked the machine before the surgery began. After the ordeal, Sarah was compensated with $25,000, but it didn't make her mental health any better, and she even had to quit her job because of her unavoidable panic attacks. Number 7. Miles Brazil. A man named Miles Brazil from Reno recently suffered an extremely traumatic experience and something that can only be described as torture after waking up in the middle of throat surgery. This happened at St. Mary's Regional Medical Center back in 2018, after Miles arrived at the hospital due to choking on an air pump cap while he'd been inflating his bicycle tire outside of a coffee shop. He was rushed into the emergency room of the hospital and was prepared for surgery after a short workup. Before the surgery began, Miles told the doctors that he had a previous incident of surgery in which he couldn't be kept sedated by a common anesthetic. Now, this piece of information should have alerted the anesthesiologist already, but as it turned out, Miles, unfortunately, had to go through a similar experience. Again, he woke up during the procedure and felt extraordinary pain. The procedure wasn't even successful, and Miles later coughed up the cap on his own and filed a lawsuit against the doctors. Number 6. The naughty anesthesiologist. The next story is a little different as it's actually about a naughty anesthesiologist who apparently stole drugs that were supposed to be used for patients, and then ended up overdosing on them in a hospital bathroom. In a shocking lawsuit, an anonymous patient claimed that Dr. Bradley Hay used the sedatives that were meant for his surgery on himself, which caused him to wake up in the middle of an operation. The doctor finally admitted that he abused drugs while on his job. We don't exactly know what happened next, but probably the doctor would have lost his practicing license, and the patient would have got some compensation for the horrific experience he had. Number 5. Chloe Kahn. Chloe Kahn is a model, and like most models, got some body modifications done to look flawless. But not all of her surgeries went smooth, as when she was getting a nose job, she woke up halfway through the operation. This incident happened in Ukraine. The procedure went horribly wrong as she lost her sense of smell too. She couldn't breathe through her nose for 8 months and had to live with a horrifying memory of waking up right in the middle of her operation. Number 4. 11 Irish patients. A recent study has found that in just 1 year of surgeries throughout Ireland, at least 11 patients were awake throughout the operation. Apparently, this is a thing that happens far more often than is reported. Research shows that 1 out of 19,000 surgical patients go through the same. This study was carried out by the Royal College of Anesthetists, and they found at least 300 cases of accidental awareness had occurred when general anesthesia didn't work. As we've already learned today, this could lead to crippling stress, PTSD, panic attacks, long-term psychological damage, and an inability to function in daily life. Number 3. Simon Rosenqvist. A young man from Sweden named Simon Rosenqvist recently had the most traumatic experience of his life when he woke up in the middle of his surgery, which he was undergoing due to a collapsed lung. According to the report from NBC News, the operation occurred in March, and Simon immediately filed a complaint with Sweden's National Board of Health and Welfare. According to him, he woke up during the operation but couldn't even twitch a muscle to alert the doctors. He was awake for 35 out of the 50 minutes that the procedure took to complete and was in debilitating and excruciating pain for the entire time. What had happened was that the anesthesiologist had noticed a drop in his blood pressure and stopped the sedatives from administering. However, he didn't notice that Simon was waking up with an increased heart rate and blood pressure. Under those circumstances, he could have administered the anesthesia again to save Simon from the pain he went through. Number 2. The awake craniotomy. Surgeons at the Smilow Cancer Hospital in New Haven have recently perfected a bizarre procedure known as an awake craniotomy. This procedure is incredibly strange because it actually involves a person being completely awake while the doctor is performing brain surgery. Reporters from Fox 61 actually watched the procedure happen in front of them and said that surgeons removed an entire tumor from the brain while the patient was awake. The surgery was performed on 31-year-old Andy, who was a singer, but his life came to a dramatic halt when he learned that he had a brain tumor and needed to get it removed as soon as possible. In the first part of the surgery, he was given anesthesia and the surgeons drilled through his skull and removed bits of the tumor from the left temporal lobe of his brain, the part that controls language and speaking skills. Andy woke up within 20 minutes of the procedure, and the neurosurgeon had to perform the rest of the operation with him awake, asking him questions and telling him to repeat tongue twisters to make sure that his language functionality was preserved as much as possible during the operation. Number 1. Carol Wire. Carol Wire had a degenerative eye condition that caused her to be in significant pain every single day of her life. It eventually became such a burden that the only way to get rid of the pain was to remove Carol's right eye. She went to the hospital to have an operation, which was supposed to last 5.5 hours. After 2 hours of the operation, Carol was wide awake, but thankfully, the local anesthetic numbed her eye and she was saved from experiencing the pain during surgery. However, she could still feel the pulling and tugging of the surgical team as they ripped her eye out of the socket. Aren't these instances of people waking up during surgery too horrifying? What do you think of these? Let us know in the comments below and be sure to like and subscribe.